This video will go over what is Alzheimer's disease, some early signs, and prevention methods. So what is Alzheimer's disease? Alzheimer's disease is a form of dementia that destroys memory and mental functions. It develops gradually and slowly damages more and more brain cells. In this image, we can see a healthy brain on the left. In the middle, we see a mild form of Alzheimer's disease. This happens due to beta amyloid plaques. On the right, we see a severe form of Alzheimer's disease where one side of the brain is very damaged. Next, we will discuss early warning signs of Alzheimer's disease. Early diagnosis helps victims maintain psychological and social normalcy for a longer period of time. The first is memory loss. Early signs include not remembering conversations, appointments, or important events. They may also ask the same questions or repeat a statement over and over again. Alzheimer's disease amplifies this to the point where one may not remember names of familiar people or objects. Another example would be frequently missing payments and not being able to manage finances. Another example that falls under memory loss is misplacing items, typically leaving them in odd places. For example, in this image, glasses are found in the refrigerator. Being confused about the time or place is another sign of Alzheimer's disease. For instance, getting lost in familiar places or treating familiar objects as unknown. This kind of disorientation should not be taken lightly. Problems with speech and writing also manifest over time. Patients will begin to have trouble finding the right words to reference objects or experiences. In very advanced stages, language becomes difficult for others to understand. Patients may also have trouble writing, and the alphabet may look unreadable, naturally making it difficult to read. People with Alzheimer's disease have been found to have a decreased sense of judgment, which in turn leads to poor decisions. Some examples would include sharing private information with strangers, lacking traffic sense, or dressing inappropriately and maintaining little hygiene. Frequent changes in mood and personality are also concerning. The chemical imbalance in the brain also affects behavior in patients. They may become irritable or aggressive and have mood swings often. Social withdrawal. A person with Alzheimer's disease may become less involved in projects at work. They may start withdrawing themselves from favorite hobbies, sports, and social activities. Their disinterest in interacting with others can be problematic if they depend on someone for their routine functioning. Now, some prevention methods. There is currently not a cure for Alzheimer's disease, but there are changes you can make in your life to lower your risk of getting Alzheimer's disease. Physical activity has been shown to decrease the likelihood of Alzheimer's disease. You should aim for 150 minutes of exercise per week. Some great ways to get exercise are walking or swimming. In addition, keep in mind strength training is great because it improves muscle mass and strengthens your bones. As you get older, balance exercises are important because they help prevent falls. Keeping blood pressure and cholesterol under control have also been shown to decrease the likelihood of getting Alzheimer's disease. Remember, normal blood pressure is less than 120 over less than 80. Mental stimulation is also a great way to keep your brain active. Try to learn something new, like a new instrument, learn how to paint or how to knit, play strategy games such as crossword puzzles, and lastly, practice memorization such as relearning all 50 capitals of the United States. Lastly, get enough sleep. Establish a routine to try and get the same number of hours of sleep every night. You should aim for 7 to 9 hours a night. A routine can help you wind down before bed and limit naps during the day to make sure you will be able to sleep well at night. Here is a list of references, which may also be used as additional resources. Thank you.